So I want to do a quick review of what's going on in Pennsylvania as of October 28, 2020. So I'm just looking at the epi curves. This is divided by region in Pennsylvania. So the number of cases per day, and you see we started in the beginning of the pandemic. There was this quick increase, and then we had this decline, which looked good through July. August it started creeping up again and went down, and now we're going up again. Hopefully we won't be back where we were before. It doesn't necessarily mean that the deaths are going to be massive like they were before, so hopefully that won't happen. But this is not something that you should not be concerned. You should be concerned about this. In other words, it seems to be worse in the northeast region, which is the southeast region, which includes Philadelphia. When you go up to the some other regions, southwest looks like it's a little troubling, as is I guess the South Central. So this is something that we need to follow in terms of what's the effect of this. I'm looking at this figure here that shows the hospitalizations. So we have in Pennsylvania, we have 1,170 patients hospitalized due to COVID-19, and 110 are on ventilators. So we have plenty of capacity. This shows you what's our capacity in terms of ventilators, and what we seem to be okay. Let's see if I can take a look at case demographics. So it's really hard to tell when most of the cases are unknown, because I guess people aren't reporting race or ethnicity, so that's not very helpful, to be honest. Let's look at we did hospital preparedness, death demographics. I just calculated these because the death report just came out. But you can see that most of the individuals who die are older still, so that hasn't changed. That hasn't changed. The distribution by sex is pretty close, not Hispanic versus Hispanic. But now I'm not really sure why this is as it is, but it could be also because there's a lot of people who are. Well, it's the way we gather the data and we discuss demographics. We first ask, are you Hispanic, yes or no? Because that's an ethnicity. And even though race doesn't really exist as a categorization, it's kind of a man-made categorization. We use it anyway, and we separate it from ethnicity, although all of these are actually ethnicities. African Americans represent, as of, I'll show you the current death report here, the weekly report on deaths, which was published on October 23rd. There were 8,625 deaths in Pennsylvania. So this is basically mirroring what we were just looking at, although that what we were looking at is even more current. However, this figure here shows that actually there was a decline in the proportion. It was hovering around 21% for a long time of all deaths were African American, which is disproportionate because there's only 12% of all the population of Pennsylvania is African American. And you have to look at those disproportionalities based on proportions of the population. I showed this to some students, and they're like, wow, a lot of white people died. Yeah, of course, you have more of this population in the state than you do African American. So you have to look at the numbers and the percentage of death and compare that to the percentage of the population. That's what we find if there are disproportionalities. So right now, it makes up about this death rate among African Americans makes up about 20%. I have 1989, 0.1989 or 0.199, and so it's about 20%. And it used to be 21, so I don't know what that means yet. I don't know. Hopefully that's a positive, that we'll keep on seeing that reduction in that disparity. And as I said, most of the deaths are among older individuals. You can see they're not. Pennsylvania's not even counting these deaths. So anything less than 5, they're not counting, or are suppressed, I should say. So that's not a major source of death. It's not really until we get to the older ages that we see a massive number of deaths. And in terms of comorbidities, well, there's a lot of deaths, obviously in hospitals, because people do go to hospitals, but long-term facilities and hospices make out a pretty substantial proportion of these deaths. Comorbidities, this has always been, this pretty much remained constant. At this at the time of this reporting, approximately 37% of all deaths records did not include comorbidity. So that means 63% did have a comorbid condition. Now, some people will say, well, how do you're just listing coronavirus as the cause of death, even though they probably died of cancer. Well, here's the issue you have to remember. The coronavirus can exacerbate an existing issue. So, it's like, if you are struggling with a disease, say you're already down and out, imagine having another issue on top of that and what that would do to you. So that's something that's very, very important to remember. In terms of comorbidities, the dementia is top. That's most likely because people are very old at this age. But hypertension and diabetes are very important, so please take care of yourselves. That's it for today, and honestly, it doesn't look really good. I need you guys to behave, do your right things, stop the spread. This is kind of stupid. It's so easy to stop the spread just by wearing a mask everywhere. And I know a lot of people think it's violation of their rights. I'd say it's a violation of somebody's right to life if you somehow, by not being considerate, kill somebody. That to me is more of a violation of somebody's liberty than your ability to wear a mask for a few minutes when you're close to somebody.